Dr. Gupta, it seems like I ask you at least once a week the following question, which I've found to be true thus far. Is your ability to get a test still largely dependent on your zip code, where you live, and where you are on the social scale in terms of income?
Yes. And, one thing to note is a lot of people are consuming telemedicine, telehealth. The ecosystem of primary healthcare is changing to be more connected. But here's the thing, to actually get to a physician or to a provider to potentially see if you need a test, you need a smartphone. You can't just have a phone conversation for that interaction to be reimbursed. And so it's not going to be provided. So these racial disparities we talk about, we could have an easy fix. Let's just have that let's get rid of the smartphone requirement, the audio visual component. Let's allow people to just chat on the phone, see if they meet certain criteria to get a test. Or let's scale up home testing. We're doing it here in Seattle. Let's do it for the country.
Dr. Gupta, you mentioned disparity. There's also a real racial disparity in terms of who is paying some of the highest costs in terms of loss of life. In cities like Chicago, Mayor Lightfoot said she was shocked when the first round of data came through. And I think it was almost 70% of the people who died in Chicago were African Americans, and they represent a much smaller percentage than 70% in the city of Chicago. What's being done on the science and medicine side to serve the communities hardest hit?
Well, Nicole, I think on the science side, we are trying to understand, are there other drivers other than what we know is already common, that across the socioeconomic spectrum, there are inequalities in healthcare access. And you tend to have you see more pre-existing lung disease, heart disease amongst those that don't have access to care. So is it as simple as that, which is a complicated socioeconomic, social problem we've been wrestling with for a long time? Are there genetic drivers? We're trying to figure that piece out. So there are some unknowns there, but there's clearly health equity, health access issues that are driving poor outcomes in certain segments of society.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.